Electrophysiology is a subspecialty of cardiology that specializes just in the rhythm of the heart. And that aspect, we kind of are termed the electricians and not the plumbers. And so we will put pacemakers and defibrillators in patients or treat abnormal heart rhythms with ablation. An ablation is a procedure that we do that's minimally invasive, where we go inside a patient's heart to correct, either by heating the tissue or cooling tissue inside the heart where abnormal electricity causes the heart to run away. When I was in medical school, I actually thought I was going to go to another specialty, but I actually had an abnormal heart rhythm and my heart would race away. And so I kind of have a really good idea of what patients are experiencing. And I saw an electrophysiologist in Illinois who fixed my abnormal rhythm, and it kind of clicked after that. And I kind of thought that was a really neat aspect of healthcare, and I wanted to get involved in that. I think nowadays in medicine, patients, with all the technology that's available, all the information that's available, and people are really in tune with their own health, they want to be a part of their decision making. And so I think, my approach is to make sure that the patient is making the decision of which way they want to go and what are the right tools and information they need so they can make the decision. I think patients, trying to make them accountable. We all, whether it's diet, whether it's exercise, it's difficult for some people to find the time, especially with a lot of cardiac conditions they have where they may have heart failure, they're short of breath, they can't do it. So I think trying to encourage and show them that there are other people that are struggling and other people have been successful, and show them those stories and show them where they can go to get the resources to get better. A neat aspect of electrophysiology is that oftentimes for some of the rhythms that we deal with, it's a cure, and we can tell them that there's a really high likelihood that this is not going to come back. I remember one patient that oftentimes people are told they have panic attacks or anxiety disorders, and by the time they get to an emergency room, the rhythm is already resolved, and so they're told that there's nothing wrong when there truly is something there. And by the time they get to us, we find it and we can tell them, hey, this is what you have. We can fix this and make it go away. And then to see them come back a couple weeks later, happy, they're joyful, they're glad that they're not crazy, and that they feel much better. And that aspect of it with those patients really means a lot, because I kind of felt that myself when I had an abnormal rhythm.